Hello, and this is my presentation. I did type 1 diabetes. So, overview of the disease. It's a chronic condition where the pancreas produces little or no insulin. The body systems affected by type 1 diabetes include the heart, blood vessels, nerves, eyes, and kidneys. Over time, high blood glucose from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. The longer you have the diabetes, the higher the chances that you will have to develop heart disease. High levels of blood glucose make the kidneys filter too much blood. All this extra work is hard on the filters. After many years, they start to leak, and useful protein is lost in the urine. People with diabetes are more likely to have glaucoma, which can come in several forms or types. Pressure builds up inside your eye when fluid can't drain like it should. Men have a life expectancy of 66 versus a usual of 77 years, and women with this disease have about a 68 years life expectancy versus 81 of people who don't have the disease. Diabetics must manage blood sugars and manually balance insulin input. Too much or too little insulin can cause fainting, seizures, comas, and even death. The long-term effects of ill-managed diabetes can go on and on. And then I have kind of like a chart up here of showing of how like diabetes could affect like the different like organ systems and the different body systems. And obviously, like I said before, if left untreated, it could do a lot of bad things to your health. So there isn't really like an exact cause, like there's no really exact like findings for type 1 diabetes, but it is a result of an autoimmune destruction of the pancreas islet cells that produce insulin. And a lot of scientists believe that like genetics like play a role. Well, they do play a role in type 1 diabetes versus type 2 diabetes, which is from just different lifestyles of how people manage their health. But pancreatic disease can also be the cause of type 1 diabetes, a lot of people assume. And up here I just have the different, I guess, risk factors that people can maybe say that why the condition was caused. But like I said, there's not really an exact, nobody really knows an exact cause of the condition. So people who are unsure about if they potentially have this disease will experience symptoms such as frequent urination, increased thirst. A lot of people, their mouths dry a lot. Unexplained weight loss, fatigue. There's like apparently there's some like fruity smell in like urine and their breath, and then stomach pain and blurry vision. This isn't on here, but also I like headaches a lot of the times could be a major symptom. And then over here I have just a chart of just showing the different symptoms of if you potentially have type 1 diabetes. So complications, so microvascular complications affect your eyes and your kidneys and nerves over periods of time. Macrovascular complication affects your heart, brain, and blood vessels also over years of having this virus. Kidney failure, stroke, heart disease, blindness, blood vessel blockage due to cholesterol plaques requiring angioplasty and stent placement, amputations, or bypass operations are all common complications. So this is obviously a very serious disease in which millions of Americans suffer from it, and a lot of people die every single year from this. And I know this is kind of graphic, but I have here a person's foot here, and to see what's done to their toe. And what happens is like circulation and nerve issues in the feet lead to stuff like this. And in this case, this toe would most likely have to be amputated because of how infected it is. So a diagnosis. So glycated hemoglobin test. It provides the average blood sugar level of the past 2 to 3 months. Also, you can get your fasting blood sugar checked, and it's usually performed after the overnight fasting. Result of the test can confirm the diabetes based on the level of glucose in the blood. You could also have a random blood sugar test, and it's performed any time of the day, and it may be repeated to confirm high blood sugar. And in type 1 diabetes, onset of proteinuria in patients with less than 5 years of disease duration in the absence of other chronic complications of diabetes, often considered indication for a kidney biopsy. So like, when people have the disease, you'll see they have some sort of like needle where they like prick their finger and then test their blood sugar, because with people with diabetes, it's not their blood sugar isn't normal. It could either be too high or too low depending on what you're eating, and that's why like diet's a very important thing that people with type 1 diabetes consider. And over here I have showing like the ways that people could get diagnosed for it. There's like a meter here showing the blood sugar level, and then a person going to the doctors here and getting their diagnosis and their screening. And yeah, that's pretty much what the charts here is saying. So for treatments, obviously taking insulin, because your body doesn't produce enough. Carbohydrates, fats, and proteins should be counted in your diet closely. Frequent blood sugar monitoring, like I was just talking about in the last slide. And obviously right here, that's this person right here is getting their blood sugar tested. Oh, I'm sorry, no, this is somebody injecting insulin into their arm, my bad. But and also eating healthy foods, obviously, like I was just talking about, exercising regularly and maintaining a healthy weight. Long-acting insulin, it's a type of insulin, obviously, where that could be taken and it lasts, a lot longer. And anyone with this disease needs lifelong insulin therapy, or they will end up dying. So prevention, there's really no way to prevent type 1 diabetes from happening. It kind of just comes out of nowhere. A lot of people don't even know they have this disease until they're in their 30s or 40s. And I have here on auto antibodies to islet cell antigens are known predictors of type 1 diabetes, are uncommonly present at its diagnosis. So here I have like the different like things and what people predict of when you get the virus here, and like the different screenings performed along with like the frequency of when you should get them. Here's type 2 diabetes, like disregard that. But then I have the recommended frequency for when you should take it. It's kind of hard to see because I'm recording on a phone here. And then I have this professional journal article. I kind of touched on this all throughout the slideshow. Pretty much what it was saying is what they thought, like what were the causes and stuff of type 1 diabetes and how you could really prevent it. And I said, I pretty much covered that in like a nutshell throughout the whole slideshow. There's nothing you could really do to really prevent it, and you kind of just, if you have it, obviously there's ways to monitor it, but type 1 diabetes, when you have it, you can't really get rid of it. And type 2 is more self-inflicted, so obviously type 1 here is definitely the worst out of all of them. And then here are just all my sources here. I have about a couple of them because I couldn't fit them on one page, but yep, that's it. Thank you.